right. Good evening, everyone. I'm going to take down our hold slide and get us started. We're about a minute out, and I want to be sure to pass the baton promptly at 6 p.m. so we can get started on time and be mindful of everyone's evenings. Thank you for joining us for a 30-minute update with our President and CEO, a member of our frontline staff, and we have 3 special guests tonight. We're really excited to have these individuals and to be able to share this time with you, and we don't take it lightly that you are taking the time, so thank you. Tonight's structure will be very similar to our prior broadcasts where we would have a Q&A at the end of the evening, but we have a little bit of a twist. So we'll also be doing a poll, just one question at the end to get a feel for you and your schedules if 6 o'clock on a Tuesday evening is the right timing for you. So feel free to stick around for that. And with that, feel free to toggle between your speaker view or your gallery view, depending on what you prefer. When we do have our Q&A at the end of the updates, we will have all our panelists on screen. So depending on if you prefer to see one person on screen at a time or everyone with the speaker highlighted, it's all up to you. And with that, thank you. And I'd like to pass it off to our President and CEO, Mark.
Well, thank you, Tiffany. Really appreciate that. Delighted to be with all of you again tonight. We've got some new friends with us, as well as some loyal followers, so we really appreciate that. Also, some of you may have been on our Chrysalis Night In fundraising event last Thursday, where we started 17 minutes late because we were simulating a rock concert, but we don't do that in real life with Chrysalis. So great to have you with us. So. As Tiffany said, we've got a number of guests tonight and an action-packed 30 minutes. We're going to have an opportunity to meet with a couple of folks who are really doing frontline work in the Skid Row area of downtown, good friends of ours at Chrysalis. Kirkpatrick Tyler, who's the Director of Skid Row Strategy with Mayor Garcetti's office. Christopher Vargas, who is with the Los Angeles Homeless Services Authority. He's the Senior Coordinator for Skid Row and the Coordinated Entry System Access, which is a lot and a big mouthful, and I know he'll tell us more about what that all involves. We'll also be joined by my colleague Shanelle, an employment specialist in our Orange County Center, and she'll help us have a nice discussion with Jane Orto, who is a Chrysalis client that has an amazing success story to share with us. So we have a few questions that have come in already. You can continue to send those in via the chat, so feel free to do that. So just a brief update on what's going on with Chrysalis. So we're in, I think, week 9 or 10 now of this crisis, and we continue to serve large numbers of clients. In fact, over 2,800 interactions between our staff and our clients over that period of time. And we continue to meet clients where they're at, helping them with jobs, and 191 of them have successfully found employment, but lots of conversations about basic needs, and I think we'll get into that a little bit later on tonight. We also continue to be very strong in our social enterprises. Chrysalis Enterprises last Friday had 461 of our clients earn paychecks, many of them working in Project Roomkey sites around the county. So we're very proud of that. You know, it's clear that this crisis is going to be with us for a long time to come. The cities and counties and the state are beginning to reopen, and we ourselves are looking very intensely at what those plans are going to look like for us. We've got a reopening steering committee consisting of some leaders throughout our organization that are looking at putting together the plans to help us safely reopen, to create an operating environment that's safe and effective and inclusive for our clients and our staff, and we'll probably talk more about that in our June update. But we're really focusing on making sure that we've got plans in place to assure the physical and psychological well-being of our staff, our volunteers, and most importantly, our clients. But tonight, we're going to hear a little bit more from the front lines. As I mentioned, we're really honored to have Kirkpatrick and Christopher with us to give us their perspective on their work. And I'd like to first introduce Kirkpatrick, and really I appreciate you taking the time out on a Tuesday night to join us. And you may be muted.
There we go.
Yeah.
Unmuted. Oh, great. Thanks a bunch, Mark. Good to see you. Good to see everybody. Always an awesome pleasure to hang out with my Chrysalis family. So my name is Kirkpatrick Tyler, Director of Skid Row Strategy. The opportunity to serve in that position for the last year and a half. And even in times like this, it's always super inspiring to be able to do this type of work and work alongside some really awesome people throughout the city and county of Los Angeles. In terms of our response to COVID-19 over these last few months, we've really looked at three major components. One and always most immediate is serving and housing our most vulnerable Angelenos. And so through Project Room Key, which Chrysalis has been a great partner in, through partnerships with our various service providers, we opened up a number of RAP sites, sorry, I can't use all my alphabet, recreation and parks partners. So throughout the city, we opened up a number of beds through our parks and recreation partners to make sure that those who are most vulnerable on the street and had the most likelihood of being heavily impacted by COVID had a safe place to go. In addition to that, partnering with the county to open up quarantine and isolation sites so that as people got tested, they were able to go to a place where they could safely be able to isolate, and not just to isolate, but also receive support and care that was needed to keep them healthy. So the first section was just providing emergency housing for our most vulnerable neighbors. The second part was providing emergency resources. And so over the past 2 months, we've allocated somewhere in the neighborhood of 100,000 to 115,000 masks for persons experiencing homelessness. As we know, masks represent kind of our first line of defense. And so we've been able to leverage all of our partnerships from San Julian and Gladys Park, where we do about a 500 mask allocation weekly, to our service provider partners such as Chrysalis, our program sites such as our Pit Stops, our Refresh Spot, our Bin, all of the places where we're able to touch people immediately, and then through our outreach partners. So of course our homeless engagement team, which is operated by Los Angeles Homeless Service Authority, through our bid partners, which have been really, really awesome to see. I think one of the unintended good that has come out of this COVID pandemic is seeing so many community partners just pull together and make their resources available. And so our bid partners made their outreach and their ground level staff available to get those out. In addition to masks, we've also allocated things like hygiene kits and hand sanitizer to ensure that folks just had some basic protections against COVID. We also had some awesome support from our mission partners and practicing social distancing, promoting it on the street, making sure that they were safe. And then our kind of final intervention was providing testing. And testing is really where we build our awareness. I think when we were first going into this COVID response, there was a big fear and concern that COVID was going to just kind of run rampant through Skid Row. But again, through aggressive testing, through the coming together of community partners, what we saw to date, we've tested somewhere in the neighborhood of 1,600 Angelenos, which represents a little over 25% of the total population of Skid Row, and about 50% of what the homeless count numbers tell us is of the unhoused population. And so that was through awesome work and mobilization by the fire department, by LAPD, by LAHSA, and also by county multidisciplinary teams. And what that helped us to do for every single week for the last month and a half, we have set up pop-up locations all throughout Skid Row where people could come and get testing. And this was in line with both their the CDC and Department of Public Health guidelines. So first focusing on those who were symptomatic, and then as those opened up, we began to open up testing to anybody who wanted to be tested. And so that made a tremendous impact, because we were able to see that out of those 1,600 some odd folks that we had tested, we only were at about a 10% contraction rate, which is really amazing. And so now We are looking at what do we do to maintain that, to reduce it, and how do we make sure that our most vulnerable neighbors remain healthy. And so that's kind of where we look at next, in addition to for all of those folks that we've placed in housing, where do they go next? And so that's like the big lift, right? This has kind of changed the dynamic of the conversation. Now that we have folks who are housed, how do we connect them into our permanent housing supports? And so it's just been an awesome opportunity to do this type of work, even in such a critical time. And a part of that work has got some new comrades. So I want to take the opportunity to turn this over to my newest friend who kind of got parachuted right into the middle of this work, Christopher Vargas from the Los Angeles Homeless Service Authority, who's been such an awesome partner over this last month. We've really been able to work together, been able to watch the transition and the needs of the community together and get some really awesome things accomplished. So definitely a pleasure, and look forward to talking more with you all.
Thank you so much, Kirkpatrick, for the introduction. Good evening, Chrysalis stakeholders, supporters, and donors. I'd like to first start with thanking leadership, Mark at Chrysalis, for having me this evening on the community broadcast. A brief overview of my background. I spent the last 8 years of my career in social services in service planning areas 2, 4, and 6 within LA County, providing both micro and macro level services to vulnerable populations, including children, transitional age youth, adults, veterans, families, and victims of domestic violence. Additionally, I hold a bachelor's degree in social work from the California State University at Los Angeles. As Kirkpatrick mentioned, I assumed the role of senior coordinator at Skid Row, or a senior coordinator for Skid Row at the Los Angeles Homeless Service Authority. And I'd like to start with just a brief overview of the Los Angeles Homeless Services Authority, also referred to as LAHSA, which is joint powers between the city of Los Angeles and the county of Los Angeles. And LAHSA is the lead agency in the Los Angeles Continuum of Care, which is the regional planning body that coordinates funding for housing and services for individuals and families experiencing homelessness. A little more about my position of senior coordinator for Skid Row in CES Access, which is the coordinated entry system. It operates under the Policy and Systems Department at LAHSA and reports to the leadership of Colleen Murphy, who is the manager of CES Access for both the city and county of Los Angeles. And essentially the goals of the senior coordinator for Skid Row will include identifying coordinated entry system gaps and program gaps, provide process improvement, and spearhead greater system efficiencies. In addition, the position will facilitate coordination and alignment of new and existing resources into CES. And with that being said, I'd like to take the opportunity to express that the role will advance equity and work diligently towards eliminating racial disparities that impact the 4,757 individuals experiencing homelessness on Skid Row, which is a combined number of both sheltered and unsheltered individuals reflected in our LAHSA 2019 homeless count. Lastly, I would like to add that the position will overall coordinate and strengthen a service delivery in the Skid Row community with a focus on LAHSA-funded programming and coordination of the LAHSA homeless engagement teams that are doing outreach on the ground in Skid Row. And the position currently is aligning with many of the strategies that the city is working on. As Kirkpatrick mentioned, our COVID-19 testing, which is a partnership with LAFD that we have had the opportunity to serve at. And our LAHSA HEP members are there on site every day at the pop-up location, providing meals and masks and psychoeducation around COVID-19 and the virus. And also they are providing referrals to housing to allow individuals to stay safe during the pandemic. And so we essentially in our COVID-19 response are referring clients to 3 tiers of housing, and our tier 1 housing would include our project room key referrals. Our tier 2 housing includes quarantine and isolation, and tier 3 includes the congregate settings that Kirkpatrick referred to as the recreation and park facilities, as well as our current LAHSA funded shelters throughout Skid Row. Another update I'd like to touch upon is some realignments in our outreach teams on the ground in Skid Row. And so currently we have our county funded Department of Health Services multidisciplinary outreach teams, also referred to as C3. We have our Department of Mental Health outreach teams, our LAHSA engagement teams, as well as our veteran outreach partners. And with the pandemic, our outreach response has shifted to a COVID-19 response, and that has included psychoeducation on the virus, the importance of social distancing in Skid Row, utilization of our hygiene resources in Skid Row, as well as daily delivering of food and masks to allow individuals to safely shelter in place. Our outreach teams are also currently utilizing a mobile-based hotspot app developed by LAHSA, Department of Health Services, in partnership with the Keto Labs to support LA County outreach workers during the COVID-19 pandemic. And just to share a little more about the hotspot app that the outreach workers are able to access through their mobile phones while on the ground. Essentially, the app allows our workers to check in with our individuals experiencing homelessness and do check-ins about their health and triage them appropriately according to their reported symptoms and vulnerabilities, which includes the referrals to the 3 tiers of housing that I just mentioned. It also provides data to decision makers to better deploy resources on the streets during our pandemic. And so, yeah, with that being said, I just want to thank you all again for having me this evening, and I look forward to continuing to work alongside all of our community partners in Skid Row. And I'd like to now transition over to Shanelle McGrew, Employment Specialist at Chrysalis.
Hello, thank you so much, Christopher. Good evening, everybody. My name is Shanelle McGrew, and I'm an Employment Specialist at our Orange County Center. I've been here since we opened our doors in 2018, but I actually started with Chrysalis at our downtown center in November of 2017. At Chrysalis, I'm given the opportunity to support those that are looking to take the big steps to make changes in their lives, and that's no easy feat. Even though our centers are closed right now, we still work closely with our clients to ensure that they have what they need. It's been tough for our clients, especially those that have worked so hard to find sustainable work, only to be laid off because of something out of their control. With that said, there have been some great positives as well. Clients who have struggled for months or longer to receive jobs have found jobs, not just temporary jobs, but permanent jobs, permanent long-term jobs. Yesterday, a client and I prepared for his Caltrans interview, and he went this morning and knocked it out of the park. Those are some really great wins. During normal times, I'm at the center, meeting with an average of 15 clients each day. A lot of the work was done one-on-one. We would work on applying for jobs, using technology, using computers that they don't have usually at home. Now these connections all need to be made by phone using the technology that we have now. On average, I would say I speak with nearly 20 clients each day. We discuss jobs and housing, but also their concerns and fears about the present challenges. At Chrysalis, our clients work really hard to find success. I'm here to guide and provide support and resources, but the clients are the ones that really put in the work. They are building on the support provided and working towards their own goals. Today, I'm really grateful to have my client, Jane, join us. Jane came to Chrysalis in August of last year. She wanted to work on a career change, and that would provide her a new opportunity. With that said, I would like to pass it over to Jane to continue her story.
Thank you, Chanel. My name is Jane Orto, and I am with the Chrysalis in Anaheim, which is in Orange County, California. And I just want to thank you for this opportunity to give back to Chrysalis what they've been so generous in giving to me. And I'm just so grateful for this opportunity. I have a master's degree in education, and I was a alcohol and drug counselor for 8 years, and then I got laid off from that. So I went back to UCI for my human resources management certificate. And then after receiving that, I was having a hard time finding a job in the HR field. So there was a gap between my unemployment letting out and actually finding a job. So I went to a PIHRA event, PIHRA, and met with someone from Chrysalis, and they invited me to the Chrysalis in Anaheim, and I went there and went to 2 days worth of workshops, which got me acclimated with the protocol for Chrysalis. And so that's when I met Shanelle during that time, and she became my helper, my support, my worker. I was just so grateful for her support and her direction in helping me find my next job. While I was at Chrysalis, I had the opportunity, I had access to the computers and the printer, and I had access to, it was really awesome because I needed to redo my resume professionally, and they had a vice president of human resources from one of the supporting Chrysalis organizations, and she helped me to create a more professional resume. And along with that, I was also provided with sack lunches, and so I would go there in the morning, and then they'd close the building for an hour, so gave us a sack lunch, whoever wanted one, then came back an hour later after lunch and just hit the back at the grindstone. And since being at Chrysalis, I was able to find a full-time permanent employment in October of 2019. And then I got laid off from that due to COVID, the effects of COVID-19 on March 26th. And unfortunately, I got denied for unemployment, so I had no income. And I just thought that once I found a full-time permanent position, that Chrysalis wouldn't want to continue the relationship. It was like, woo, you got a job. But no, Chrysalis, Shanelle would call me, text me, email me every once in a while. How are you doing? How's your job going? Do you need anything? So it was really neat because after I got laid off due to COVID-19, Shanelle called me and she said, how are things going? And I said, well, actually, I got furloughed on March 26th. She said, well, have you ever been homeless before? And I said, yes, I have. And she said, it's a real threat right now. And so she told me about a grant, and I was like, wow, this is so awesome. And she said, so let's just fill out this questionnaire. And then within a week later, I got approved for it. So I was able to pay for my rent and some bills. And I was just really grateful for that. And I was having a hard time completing my CalFresh application as well. So I was able to get assistance with that also, and that got approved. So I have had the opportunity to benefit from the support of Shanelle and Chrysalis, and I'm grateful for the opportunity to give back. And I always get emails or text messages from Gabriel and Caesar and Denora about job leads, and Denora sends these great emails about what to do because COVID-19 has changed recruiting and job searching. So Denora sends emails with strategies for job search. So yeah, I'm really grateful for Chrysalis. Thank you.
Well, Jane, thank you so much for joining us today and sharing that story. It's this is why we do the work that we do. It's really great that we have this personal connection with our clients. And as you said, you shouldn't be surprised that we reach out to you, because once you're a Chrysalis client, you're always a Chrysalis client, and we want to help you succeed in whatever way we can help. So thanks for joining us, and also thanks to Kirkpatrick and Christopher and Shanelle. I believe we have a few questions. We've got about 5 minutes left. So let's, Tiffany, I'll let you be the moderator here and help us out.
Wonderful. Happy to do it. Thank you again to all of our panelists. The first question is actually from Chrysalis to all of you, our wonderful attendees. We're going to conduct a really quick poll to get a sense of what time works best for you to attend one of our broadcasts. Again, these are 30 minutes. Would it be better to do it after you've had your morning coffee? Are Tuesday evenings perfect? Just let us know. This question is also going to our panelists too, so we can get a well-rounded response that we can take into consideration for our future broadcasts. Our next broadcast will be on Tuesday, June 16th, if I did the math correctly. So feel free to look out for an opportunity to RSVP for that. So thank you all for taking a moment to answer that, so we can make sure that we're aligning with your schedules. All right, and I'll give it about 10 more seconds before we kick off our Q&A.
Hey, Tiffany, I think there may have been a typo on that survey. It says 6:30 is perfect, but I think we meant 6 o'clock, right? That's the start time we've been using.
Oh goodness, thank you. Thank you guys. Keep me on my toes. That should be 6 o'clock.
It was planned that way. This is an interactive poll, real-time data coming at us.
Thank you all. Thank you all. All right, I'm going to end that poll real quick. And it looks like 6:30. I'm guessing everybody meant 6, keeping it at our usual time. So thank you all for letting us know. All right, we're going to kick off our Q&A. Our first question is, what does Skid Row look post-COVID-19? And we're going to ask if Kirkpatrick Tyler, could you speak to that, please?
Yeah, so I think very quickly, Skid Row looks like a lot of opportunity after COVID 2019, right? As I was saying earlier, so much has changed in terms of how the conversation has to be had as we've moved folks into this emergency housing, as we have made all of these investments around health and hygiene infrastructure with hand washing stations and restrooms. And then there's one other thing that's been going on kind of under all this COVID response has been all of these awesome programs. So the Refresh Spot has a new home that'll be complete in a couple of days. We have new mobilization and leadership for the outreach teams. We have 5 new water hydration fountains that just got installed this week. The bin is now expanded. So there's all these things that have been going on. And I think that once we get away from our COVID kind of emergency response and look at stabilization. And then today we housed our first 4 women for our Project 100 housing initiative. So I think what we could look at like, oh, what does this mean? How long are we going to be at home? But I think really what there are all of these opportunities to refocus the conversation and say, look what we were able to do in an emergency. And now how do we make those things sustainable? But I do think the one other thing is that we have to keep the voice of advocacy in the conversation. We have to be sure that, of course, as like budgets are changed and dollars are rearranged, that we keep Skid Row in the forefront. Not so much a conversation about don't leave us, but saying, hey, look what happens when you make an investment inside of Skid Row community. Look what happens when you put resources in how we're able to transform. While I know we have to pull some stuff back, let's keep doing that.
Thank you, Kirkpatrick. We are coming up on 6:30, but we do have time for one more question. We had an attendee ask if we are still in need of clothing donations or in-kind donations. I'm going to ask if Mark can speak to that really quickly. For those of you who had questions that we didn't get to, we promise that we'll follow up with you directly. Apologies for cutting it short.
Yeah, that old Zoom mute thing. Our clients need clothing. Unfortunately, we cannot currently accept donations. That's been the best practices recommended by the various health authorities at this point. I know we will get back to that. And we're actually spending money directly to buy clothing for clients as needed. If they need work shoes or something like that, we'll go ahead and buy fresh ones. So we will get back to accepting donations at all of our centers once we get a little bit further past this crisis, I certainly hope. And I am looking at the big clock on the wall. We keep our commitments to start and end as close to time as possible. Again, huge thanks to Kirkpatrick, who's got the coolest background tonight, although Christopher, yours is pretty cool as well. I did have to invest in flowers today because I got some feedback on the last broadcast. My background was a little boring, so, flowers. Shanelle and Jane, thank you very much for joining us as well. And I thank everybody in the audience today for your continued support of our work. We hope to see you at our next broadcast on June 16th, right, Tiffany? Did I get that right? June 16th?
Yes, sir.
At 6 o'clock, it sounds like.
6 o'clock. We'll see. All right. Thank you all. Have a lovely Tuesday evening.
Thanks, everybody. Good night.